Hi everyone, my name is Janis Slezins. I am board certified neurosurgeon practicing in Riga, Latvia. Today I want to discuss the most common damage sites of the nerve roots within the lumbar spine. So in order for us to understand better what is happening and what potentially can happen in the lumbar spine, we need to know the basics of anatomy. I have a model of lumbar spine, and as you see, lumbar spine consists typically of 5 lumbar vertebrae. 1, 2, 3, 4, 5. Lower than L5 vertebrae is a sacrum. Sacrum consists from 3 to 5 fused together sacral vertebrae. In between of corpus and arch there is an interspace which is called a spinal canal. Spinal canal is the place where spinal cord and nerve roots are living, let's call it like that. In between of vertebral bodies there are intervertebral discs which are formed from cartilage. They are elastic, they allow us to bend forwards and backwards and sideways, and they also act as a shock absorbers. So nerve roots are leaving spinal canal in between each two vertebrae. So for example, this is vertebrae number 1, lumbar 1, L1, and nerve root is numbered accordingly. This is L1 nerve root, this is L2 nerve root because it's leaving under the vertebrae number L2, L3, L4, L5. Nerve root number S1 is leaving under the S1 vertebrae. Please keep in mind that S1 vertebrae actually does not exist. It is a part of the sacrum. As we have already discussed, sacrum consists from fused together vertebrae. The most common site of damage within the lumbar spine is a segment between L4, L5 and L5-S1. Why is that? Because biomechanically there is a maximum load on these two segments and they wear off earlier than the others. And for us to better understand the symptoms, we need a help of so-called myotome map and dermatome map. What are those? Basically, each nerve root has a motor function, the movement function, and each nerve root goes to exact muscle and do exact known movement. For example, nerve roots L4 and L5 are doing so-called dorsiflexion of the foot, basically allowing us to walk on the heels. And S1 nerve root is doing plantar flexion, is basically allowing us to walk on our tiptoes. And the pain and sensation distribution can be seen in dermatome map. Basically, dermatome map is a schematic image where the distribution of the pain and sensation lies for each nerve root. And for example, if there is some disc herniation which can affect, for example, nerve root number L5, we can, from the symptoms that patient describes, from the distribution of the pain and maybe motor function, we can already have some idea without even the scans where the problem is possibly lying. And after performing MRI scans, we can find out, yes, it's true, and the problem is in between L4 and L5. So this knowledge about dermatomes and myotomes, location of the nerve roots and their function help us to understand where the potential problem could be and help us to establish correct diagnosis. Thank you for watching this video. Please subscribe to our channel, hit the like button and comment and ask your questions. We will try to answer them as best as we can. Thank you.